Are you using nasal sprays for your allergies, but not getting the relief you expected? You might be making one of these common mistakes that we see as allergists all the time. Nasal sprays are a really powerful tool for managing allergy symptoms, but they have to be used correctly. And today, we are debunking common myths and sharing expert tips for using allergy sprays effectively.
Hi, ladies.
Hello.
How are you all this morning?
I'm here. Got a sick kid in the other room.
Same. You'll hear some dogs and kids.
We realized while we were meeting after our initial recording that we didn't get a chance to talk about one of the most powerful tools in our allergy toolbox, which are the nasal sprays. And I don't know about you, but in my practice, with almost every single patient, even allergy veterans they've been to the rodeo more than once, there always are some things that we can talk about to really optimize their use. And so I'd love to hear your experiences and also see if we can learn from one another as we're sharing with our listeners and viewers today all of our techniques that we like to share.
One thing I like to point out is that nasal steroids are the first line treatment for rhinitis or nasal allergy type symptoms. I think so many times when we go to the store to get an allergy medicine, the first thought is, oh, we're going to get a pill or a liquid to treat these symptoms. And really, nose spray is the first thing we should be grabbing off the shelf.
Yeah, that's absolutely right. I always tell people antihistamines are really great for itchy, watery, sneezy. But if you are congested and having a lot of nasal issues, you really have to treat that primary target right there if you want to get better specifically for all of that.
I think the other thing that a lot of my patients, especially kind of in this area of a little more holistic practice, is folks are always wanting to use like the most local kind of low-hanging fruit type treatments and really trying to simplify regimens. And I think there's this like struggle between, oh gosh, it's a steroid. There's a lot of fear around that term, but really you're using a much lower dose and using it locally. And often for many people, that can be, when used correctly, a single med and kind of doing it all.
I totally agree. I think explaining it exactly like that it's local treatment, meaning think about if you had a rash on your arm and you grabbed some hydrocortisone and you rub the hydrocortisone just topically exactly where you need it. That's exactly what you're doing with a nose spray. You're putting that very low dose medicine right on that nasal tissue, and very little, if any, gets absorbed to the rest of the body. So it's a topical, local, targeted treatment.
Yeah, one of the things my patients say a lot is, oh, I don't want to get addicted to it. And so that's where we come into the discussion about, well, a nasal steroid is different from the vasoconstrictors that we all have heard about.
Why do you have that in your house?
And so just to clarify what they mean by that is that whenever you use one of the nasal decongestants, it does definitely feel great for a little bit, and it's fairly immediate. And so it helps the swelling to go down pretty quickly, and it's okay for short-term use. The issue is when you start to use it daily or for longer periods of time, it stops working quite as well and as long. And we have had patients who come in, for instance, and are using it every 30 minutes. And so that's not something that is sustainable long-term, and it's not healthy to do. And what I tell my patients is the nasal steroid is different. It's technically, if you have symptoms, it's meant to be used every day. And I do have patients I'll instruct to do it daily, sometimes twice a day, depending on the dose. And it also depends on the season as well, if they need it. But I also have a lot of people that use it as needed, which again, it's not really indicated for that, but truly they do great with the nasal steroid as needed. So they feel like they're not having to use much medication, but they can get the relief whenever they need it.
That's so true. And then nasal antihistamines, similarly to the steroid, are not addictive, can give you some quick relief, be used as needed. So there's a few different things, and these are all over the counter that are right at our patient's fingertips. But I can see how as maybe a lay person going to the store and just looking at what's in front of you, there's so many options. It's hard to know what to pick.
You guys want to do where we talk about, like, I'll say our favorite nasal steroid spray that's over the counter on the count of 3? Definite.
Okay,
I don't need to think.
I know which one I would say.
Okay. Ready? 1, 2, 3.
Flonase.
Yeah.
We did not plan that.
No, we did not plan that, but it really is the best.
Sensimus people want to reach out and sponsor us, then
Yeah, we would
could
love
explain in
that.
great detail why we like it, but there are other ones that are good too.
Yeah, absolutely.
And I think that's an important point, that there are many options out there. And maybe if you've tried triamcinolone or Nasacort, or you've tried Rhinocort, which is budesonide, or regular Flonase versus Flonase Sensimist, each of those has different properties. And so just because you've tried one and maybe it hasn't been a great fit, that doesn't necessarily mean that the others aren't going to be as helpful or are not worth trying. For instance, regular Flonase has a bit of a floral smell. So often my patients who have migraines or are sensitive to stronger smells, like, that's not my first choice for them. Or maybe they've already tried it and said, yeah, this was a trigger for my migraines. So then we opt for a different formulation that doesn't have that floral smell.
Mm-hmm.
Do you guys want to show how to use some of the nose sprays? Yeah? Okay. I'll start. I received this as a sample in my office. It's called Astapro. Azolastine is the generic name, and that is in very small print underneath. This is a nasal antihistamine, so it works kind of like cetirizine or fexofenadine that we take by mouth, but this is for the nose. And it works well for both allergic and non-allergic rhinitis, to be honest. It's really good at drying up like the goopy postnasal drip, congestion. Let me just get it out of the box. And in our house,
And it is one of the newer ones over the counter too. It's only been over the counter for maybe 3-ish years, 4 years.
I will also say we have 6 people in our household. So when I buy nose sprays at the store, I get one for everybody. It's like toothpaste. We are not sharing a nose spray. No.
Good call. Great reason to have that Sam's or Costco membership.
All right. So the first time you use a nose spray, you want to prime it. You want to make sure you can see the medicine coming out. So I'll just kind of close here and see if we can get the mist. So nothing came out there. Ooh, did you see that?
A little bit, yeah.
So then when we put it in the nose, usually we'll use opposite hand to opposite nostril, straight back, and then make sure we're aiming away from the septum. So the middle of the nose is the septum. We don't want to aim towards it. We want to aim away, kind of like towards the eye or the ear. And then you do your squirt. I just did a little tiny sniff.
And I'm going to point out that you did not do a big sniff.
For sure.
Yeah, that's why I always tell my patients one thing that we learned whenever we were fellows. Very first, I remember Dr. Fox talking about this all the time. And we would say nose to the toes. And so one of the things is that you don't want to sit up and then spray your nose spray up, because you really just hit the roof of your nostrils there. You don't actually go back into your sinuses. So I always tell my patients nose to the toes. So if you can imagine you're standing or sitting, you lean over a little bit. And so whenever you use the opposite hand to spray, you're already kind of pointing it in that direction. And we're just supposed to do a nice gentle breath in as we do it. And I have Air, which is a nasal saline gel, and I recommend it on the daily, and I use it multiple times a day myself. It's so soothing. But I go ahead and use it now, actually, if that's...
And that does not contain medicine. It's just salt water, right?
Nope. And it feels so good. And so what we're not supposed to do at the end, we're not supposed to, or anything like that. What we always tell people is that you just do a gentle breath in as you do it, and then you sit up, and that's that. And if you have a little that kind of comes out, you can dab it, but most of the time you don't really even have that issue.
Yeah, I'm going to follow up the second half of that rhyme of nose to toes. If you taste it, you waste it. So especially with the Astapro or Azolastine, it does have a bit of a taste to it. And so, and it's not the most pleasant. So one, that's a good thing to know and to be aware of. But also using this type of technique is going to minimize how much of that is dripping down the back and getting some of those taste buds.
Absolutely. I tell people to do it before they brush their teeth. My nurse tells people, and this is for the ones that have a taste or a flavor to some people. I say, and I keep it in my toothpaste drawer. So whenever I brush my teeth, I just go ahead and use that. Then I brush my teeth and I really don't taste anything after that. My nurse tells everyone to use it and then eat an M&M, which I like that as well. An M&M is always a good idea. But there are things that you can do to mitigate the taste if it's aggravating for you. Some people will say, eat a mint, chew some gum. I always hate to see people who miss out on using the really effective medicines that could have a taste because they don't like it, because there are ways to kind of quickly move on from that and still get the benefit of the medication.
How long do you tell people to give a nose spray to really feel like they've given it like the old college try? Like that they have like, okay, we've tried it. Is this going to be what's right for me or what's not?
I usually say 2 weeks minimum.
Yeah, I think
I tell people it doesn't mean it didn't work if you don't feel better immediately. Don't expect that. It'll take at least 2 weeks and then we can see how you're doing.
And that doesn't mean it'll take 2 weeks for you to feel any benefit. I mean, you might start noticing improvement pretty quickly.
Right away.
But to really see, is this something that long-term is going to help me feel better every day, breathe better through my nose, not be annoyed by drainage, dripping, not be annoying other people. Give it a couple weeks.
What about, I think one of the other really common things I get asked about or kind of comes up in the conversation are, gosh, those nose sprays, I get nosebleeds every time I use them.
First would be technique. Are you spraying it toward the septum, so toward the middle, or are we doing it to the side, which are where the turbinates are? And I'll tell my patients that's the tissue that overlies the bones that sort of make up the inside of your sinuses there. And so that's where we want the medicine to go. So if you're spraying it to your septum, you can often be aggravating that tissue there. That's where we have Kesselbach's triangle, all the little arteries right there. And if we aggravate those, you can get a lot of nosebleeds. So make sure you're doing it the right direction.
Also, you can take breaks. I mean, certain times of year, people's environments are drier than others and can just naturally make your skin and mucosal tissues drier. So maybe you need to back down to, instead of 2 sprays each nostril every day, maybe you're doing 1 in one nostril one day, 1 in the nostril the other day. You got to find a balance between controlling the inflammation and any mucus production you're having with not drying out that mucosal tissue too much.
I feel like, especially with my patients with Sjogren's, which is drying, and they have allergies or non-allergic inflammation, super common. We are always trying to thread the eye of a really small needle in regards to turning down that inflammation, but also keeping those tissues moist and also soothed. So I am often using in combination with like the air gel, sometimes xylitol containing sprays, which are also moisturizing. A common brand you'll see at the store is called Xlear. Kind of looks like clear, but instead of a C has an X. Those also do have a taste because it's a sweetener, but those are some other things that are sometimes helpful. And that's, I think, the other, going back to the different formulations too, where sometimes, and maybe I don't want to speak for you all, but that's one of the reasons I like Sensimist, because it does seem to be a little gentler and maybe a little less irritating for some folks.
For sure. What do you say to people who are afraid of using nose sprays? They don't like the feeling of putting something in their nose, or sometimes parents will make assumptions about their kids. Oh, he would never do that. She would never do that. But maybe they haven't tried. What are how do you approach that?
I like to just start by asking them, tell me more. Like, because each person, and I myself can jump to assumptions as to why that may be. But usually there's a story behind it. And sometimes knowing a bit more about that story can be really helpful at untangling some of those like preconceived notions, limiting beliefs, icky experiences, and also just thinking, okay, well, if a nose spray isn't helpful, would we consider does that mean anything nasal is off the table, like a sinus rinse, or there's even some like nebulizer type treatments for the nose, and then symptom burden. Is it something that maybe we do try orals instead, or lean on immunotherapy much sooner than we might in another patient?
I'd like to ask exactly what part of it do you not like? Do you not like putting something in your nose, period, which is sometimes that's a harder barrier to overcome, to be honest. But whenever people are like, ooh, I hate that feeling of it going down my throat and I hate the taste of it. And I'm like, well,
I can just now taste the Astapro. So go on. It's fine. It's fine. Go on.
So, but yeah, and that's what I want to know. Because we could technically, I mean, you can choose a formulation that probably doesn't have that. And so, and I always tell people, for instance, we talked about the Scentsy Mist where that doesn't have a smell. The other thing, I don't know if you guys remember when it was Veramist before it was rebranded as Flonase Scentsy Mist, the drug reps would come around and that was how it was marketed. They would hold their hand up and they would be like, look, it doesn't drip. See? And sure enough, it did not drip. It was kind of sticky. And so I tell them about that. And I always also tell them that it's the only one my own kids will tolerate. So, my kids use it. I suspect your kid would not hate it as much as others they've possibly hated before. All right. Well, I think that this has been an awesome discussion. And we're really excited to share all of this knowledge and our personal tips that we use, since it seems like we all frequently use a nose spray. And if you have any questions, comments, likes, anything like that, please stick them in the comments section and follow us for more information from your allergy besties at
Allergy Actually.